Let's try to get to the bottom of it. Joining me, dual board certified OBGYN, Dr. Greg Marchand, and author and certified mental health counselor who specializes in child abuse, neglect, and trauma, including teenage pregnancy. Sharonda Brown is with us. Thank you both for being here. Dr. Marchand, let me begin with you. How have you, in your experience, had patients of yours who you had to tell that were pregnant that didn't know and they were pretty far along in their pregnancy?
Well, I've seen some patients over the years, maybe as far as 20 weeks, that weren't aware that they were pregnant. But when you get to a situation like this, I've really never seen a case like this where someone would be full term and not know they're pregnant. From 24 weeks on, you're going to be feeling the baby move. And pregnancy has a lot of changes that affect the female body. It's, with the exception of someone who suffers from maybe severe psychiatric illness or somebody who has severe mental impairment, you're going to know the changes going on in your body. And if you're not recognizing it or pretending to not recognize it, that's really going to be pathological denial, where you're kind of putting it back for the secondary gain of either being able to lie to your parents or some secondary gain like continuing a lifestyle of drinking or using drugs. There's going to be a pathologic denial here. It's not going to be something that any reasonable person is going to see. And I know a while back, about a decade ago, there was a show that brought a lot of attention to women that claimed to not be pregnant, but that really isn't the case. And having delivered thousands of babies, seen thousands of women, I really don't think it's possible to go full term and really not understand that you're pregnant.
Sharonda Brown, from your experience in counseling young women, what are your thoughts about Alexee Trevizo, the possibility that she didn't know or perhaps was in some level of denial of all of this?
I think it's very possible that she didn't know. A lot of teens are disconnected from their bodies. A lot of teenagers, they engage in acts that they really are not connected to. There's a huge lack of empathy for themselves and others. And it's not because there's an extreme mental health issue. I think a lot of it is because they're just not fully developed. And so you add fear with the stories of don't do this, don't do that. And then there's a lot of lack of education when it comes to their bodies. There are a lot of young ladies who don't know how their bodies work. And I think it's important to know that sometimes trauma plays a part, especially if there was some trauma associated with her having sex. Let's say if there was something like a rape involved or some sexual abuse, that really is going to cause some blockage to the point where they're totally disconnect from their body and deny that they've even, had sex and deny that there's a child.
To me, it was the reaction in the moment when the doctor tells her that they found a dead baby, that it was obvious to me that she didn't know. She mentioned that the back pain, Dr. Marchand. What's the level of back pain that is associated with pregnancy versus back pain from having a bad back? Is it something different, or can it be confused?
Well, anybody can confuse any symptoms on presenting to the emergency room, but the back pain that's associated with pregnancy is going to be quite severe with each contraction, especially when babies are facing upwards instead of downward. A lot of the contraction pain is felt in the sacrum and the lumbar spine, and that pain is really severe. But I think it's very, very unlikely that she didn't realize from 24 weeks on that the movement in her belly, was in fact a pregnancy, and it's very unlikely that she on her own head believed herself to be suffering from some back condition that needed care. And in addition to that, her actions immediately following the delivery of the baby are just nothing like somebody who suddenly was surprised with a baby falling out of her. Somebody who was surprised like that would be screaming for help, perhaps worried about their own life, perhaps worried about the health of the baby. But the fact that she has a preconceived plan of where to put the baby and even to put the liner on top of it so it's not noticed, these are things that really talk about a preconceived plan and don't talk about somebody who's just been surprised with the news that they're pregnant and now delivering, even if such a thing was possible.
Sharonda Brown, I want you to take a look. I think we have a still image of her, and she was at cheerleading practice. And as we look at this photo, there are rumors flying around social media relative to this case. But looking at her, she's still engaging in cheering up until the end here, really, for all 9 months. But folks who have looked at these photos say, oh my goodness, how could you not know? How could anyone not know? I get it when you can hide your physical condition with loose-fitting clothing, but what are your thoughts about the images here that we're looking at?
I think psychosis is very strong and it's very powerful. I think that groupthink is very powerful. So when people aren't saying anything but saying it to one another, it's easy for a teenager to continue to believe that they are not, in fact, pregnant. And I know what pictures appear to be and what things seem to be, but I can't argue with somebody's beliefs. So if she says that she was not pregnant and she believed that she was not pregnant, and I know the regular population would say, oh, no, that definitely looks like a belly. But to a teen who is continuously cheering, coach has not said sit down, or no one's offered medical help, no one's given her a pregnancy test of any kind, it's easy for her to continue to believe that she in fact is not pregnant. And with photos, these days anything can be what you want them to be in a photo. So
and how about what Dr. Marchand mentioned, which I think is an important point and will be a big part of the trial in this case, which is her reaction, walking back from the bathroom, saying nothing, hiding the baby, all of that. From your perspective, what does that tell you about her state of mind at that moment where she's just given birth to a baby?
I think it's shock. I think it's fear. I think it's all of that denial. I don't think it was premeditated, as the doctor suggested. I think that to go to the hospital because you believe you have back pains, I don't think someone who truly thought that they were pregnant would go there and say, hey, I think I have back pains. I truly think that she was completely disconnected from her body. And as it became more real, meaning she pushed this baby out, I think she got shocked and decided to hurry up and cover up what she believed was, a shameful act. I think that's what we saw, the covering of a shameful act, not so much as the covering up of, the killing of a child, but a shameful act, if that makes sense. Which was
the getting pregnant and having sex in the first place. Okay, Dr. Marchand, Sharonda Brown staying with us. Still to come. Did her boyfriend know she was pregnant? Still with us, OB/GYN Dr. Greg Marchand and mental health counselor Sharonda Brown. We can all agree the fact that they had sex. There's no doubt that they had sex, okay? We're gonna lay that down. So she continued as a cheerleader. So I'm wondering if the sexual activity from at least 9 months before all this happened or around then likely continued. So Dr. Marchand, this is kind of an awkward question to ask, but from your perspective, at what point would a boyfriend who may be, actively engaged in what young men and women do, notice changes? And would it necessarily be obvious?
In this case, it just might not be obvious. Obviously, the body changes in pregnancy are severe. If you're looking for them, it increases in the curves of a woman in many different areas is going to be common in pregnancy. But while I do think that Alexee did know about the pregnancy inside, this is something I see with a lot of these cases. I've taken care of thousands of pregnant women, and those that have claimed that they didn't know they were pregnant for quite some time have this type of pathological denial, where part of it is convincing family members, convincing the boyfriend, convincing the mother that they weren't pregnant, so they can kind of use that feedback back to try to convince themselves. But there really isn't any convincing themselves in the deepest levels because they've got that wiggling baby in their abdomen and the constant reminder that they must be pregnant from the changes in their body. But I have seen patients exhibit this type of pathologic denial before, where they make it a goal to fool the boyfriend. And, in most relationships, the boyfriend wanted the relationship to work, wanted her to be happy. So I could see a teenage boy going along with these types of persuasions and perhaps actually not knowing that she was pregnant, even if they were sexually active in the third trimester.
Sharonda Brown, what are your thoughts on this one? Because, there's going to be a trial. He's a witness in the trial. He's going to have important information, and he's going to be sworn to tell the truth, the whole truth, and nothing but the truth. Is it possible that he didn't know or didn't notice or they didn't have the conversation about it?
I think it's possible that there is a strong disconnect there because with teenagers, if they don't have to have the conversation, they don't have to do anything about it. If their life can go on uninterrupted, regardless of what it is, a baby, chores, they're not going to engage in it. And I think it's very possible that as long as she was fine, he was fine. If she say, okay, I'm not pregnant, I don't know what my back problems are, I don't know where this come from, he went along with it and said, okay, because he trusted her, that she knew her body better than he did. I think it's possible to continue to engage in acts if they were having sex. And I also don't think that we know how long the baby had been deceased, or how do we say how long the baby was moving around, or if the baby was moving or very active. So there's so many moving parts with this that it is very difficult to say what they actually knew and what they denied, or what they thought was happening versus what really happened. So I do believe that teenagers are so egocentric that they disconnect from almost everything if they have to.
You know, Dr. Greg Marchand, Sharonda brings up a great point here, and I'm wondering what the answer is. If a baby that is growing, and maybe, you know, this one's full term is the way the baby was described, but that baby is no longer alive in the mother's stomach, if it's going to be a stillborn child, how will that manifest itself, and how long could a child not be alive and remain inside the mom?
Well, it could take some time for the body to realize that the fetus has passed away, so it could be even as long as a week to go into labor. But an important point here is if the baby did die, the baby stops growing at that point when it died. And this was a full-term baby, so this was a woman experiencing the movement that you get at full term before the baby passed away. And I've heard different things about when they believe the baby passed away, but just the fact that we know it made it to full term means there was a trimester full of movement that would have had to be ignored. And I do agree with the counselor's statement that teenagers go a long way to try to ignore these things, try to block these things out. But I think deep inside, she did know she was pregnant, and it was a case of pathological denial for her to try to convince everyone else that she wasn't pregnant, largely just an attempt to try to make it true.
And I'm wondering, the other factor in all of this, Sharonda, is that she goes to the hospital. I think she's got to know, if I go to the hospital, they're going to be able to figure out that I'm pregnant. And like, my mom's with me can someone be that deep in the denial and the suppression that they could actually go to the hospital pregnant and believe that no one's going to find out? Or could it be that she didn't actually know? Which of those makes more sense to you?
Well, you know, in all transparency, I did it. I was 15, pregnant, and I got sick. I didn't know what was going on. My body was changing, and I thought that something else was happening, and I went to the hospital. I asked my mother to take me, and when the doctor came in and asked me had I been active, I lied. I said, no, I have not. She said, well, tell me why you're pregnant, and I just kind of looked shocked. But that type of disconnect is very, very real. It is very real. And it wasn't that there was manipulation there or me, intentionally lying. I was more concerned about not getting hurt by my mother. And that was more important to me than anything in that moment. And to a child, that is important, not getting in trouble. They will go through measures to avoid getting in trouble. And that, everything else doesn't matter at that point. Right. So I do believe that it's possible to deny that and to really, truly believe that it's not there.
I want to thank both of you for your perspectives. Great to have you, Dr. Greg Marchand and Sharonda Brown. Thank you both so much.